Dr. Plys is a licensed clinical psychologist, board certified in geropsychology. His focus is us, everyone in our audience today and future listeners. He works at the Center for Health Outcomes and Interdisciplinary Research at Mass General Hospital in Boston and is also a faculty member at the Harvard Medical School. His own program of research has focused on developing psychological therapy interventions for older adults and their care partners during stressful transitions for the long-term care continuum. He has devoted much of his own research to improving psychological services in nursing homes. Please note, he is currently working to launch a specialized caregiver clinic at Mass General Hospital in Boston that will provide group and individual therapy for stressed caregivers. This group and individual therapy will be starting up this calendar year. And now, without further ado, Dr. Evan Plys.
Thank you so much, Barbara. That was a really lovely introduction. I'm very humbled. And thanks so much to MADRC for having me. As mentioned, I'm a clinical psychologist. So in my job, I actually see caregivers as clients. And so I'm a therapist for family caregivers, and I also have a research role. So really excited to talk about this topic. And also really grateful to not only have the forum to talk about this, but your attention and attendance as well. I do think it's hard sometimes to talk about emotional health, and we acknowledge it. It's everywhere when we talk about dementia. We're always talking about how stressful caring is as well. And today I really want to kind of get in there and talk a little bit more about that and share some opportunities to get some support, and also just understand kind of what we mean when we say what is stressful about the caregiving journey. I don't have any disclosures to report. I don't prescribe medication, so Big Pharma's not coming knocking at my door. But without further ado, let's get started. So I wanted to start just by acknowledging, even though we're going to be talking about emotional stress amongst care partners, caregiving is not all that bad. And I think this is an important thing to keep in mind, that almost half of caregivers say that this role, this journey has been very rewarding. People talk about an increased sense of purpose, a sense of meaning, learning things about themselves, self-growth, and even stronger relationships with the care recipient. So there's a lot of positives that happen for folks across, along the caregiving journey. And it is hard. So particularly when caring for a loved one with dementia, care partners of a loved one with dementia have the highest emotional, financial, and physical burden of any adult illness. So there's something about this illness that's really challenging. About 60% of folks report high or very high emotional stress. And clinical levels of depression and anxiety are also more than double what we would see in the community. And stress is serious too. There's real implications. There's real consequences to some of this emotional stress. 1 in 3 caregivers along the caregiving process have thoughts about harming themselves. 27% don't do the things they need to do to maintain their own health. So things like your own doctor's appointments, diet, and exercise. A lot of times we put that aside to take care of others, and that does kind of accumulate and lead to some negative health outcomes. And family care partners are at higher risk of developing their own physical challenges while they're caregiving because of a lot of these factors. And stress is also very treatable. So for more than 35 years, the field's been acknowledging, testing, understanding that the caregiving journey is very emotionally challenging, and we have really good interventions that work, and those don't involve medication. So to recap, caregiving is not all bad. It is challenging at times, and those challenges can be very serious. And we have a lot of treatments that are available to support emotional health. So if you thought I was going to just lecture the entire time, I apologize. I am going to ask for a little bit of interaction. If you feel inclined to and have a pen and paper handy, you can choose to write this down. That's not at all necessary. I just want to ask for everyone to reflect on some questions right now. So the first one is, for family care partners, who's your role model? Like, who do you think of as being a really good care partner? And then along those lines, why? What attributes make up a really good family care partner? And that second question, if you feel comfortable doing so, you can share, some of those attributes in the chat. But just reflect on this for a second. Mhm. I knew patience was going to come up. I'm wondering if selflessness, caring, compassion, those qualities. We're going to come back to this. So hold, what you were thinking of, those attributes. Try to remember them because we're gonna come back to this exercise. And we're going to do another exercise first. So this one, so imagine that a friend of a friend contacts you, they're caring for their spouse who has dementia, and they tell you they're at their wit's end, that they're so stressed that they're having a hard time being nice to their spouse. They feel a lot of resentment towards their spouse. And then they feel guilty that they feel resentment, and they're just feeling really helpless and overwhelmed. And how would you respond to this person? Just think in your minds, like, what might you say to them? What's the tone in which you would say it? And now I know this is a very savvy group, so you probably know what's coming next. If you think about if you were in that situation, when you're feeling guilty, when you're feeling helpless and overwhelmed and resentful, or just any negative emotion, how do you typically respond to yourself in those situations? And just reflect on kind of the difference, either in tone, in the things that you might say to yourself versus a friend. And a lot of times when we look at these responses, the second one, we're a lot harder on ourselves than we are on other people. We can access that compassion, that patience for other folks, and then it becomes hard to do that for ourselves. So like I mentioned, I'm a therapist, and I've been working with family care partners for many years, and I wanted to share kind of like the most common reason why folks come in to see me. So I always start with, why now? What happened that made you seek care now? And a lot of folks will talk about this kind of cycle. So for example, let's say you're caring for your mom, who, one thing we know about your mom, she loves grilled cheese. And you've been working all day. You make her a beautiful grilled cheese. She sits down and she says, I don't like grilled cheese. And then you get angry, you get frustrated. Maybe you yell a little bit. Maybe you say some nice things. You always do X, Y, Z. And that's the situation. Makes sense. If somebody doesn't acknowledge you, if somebody that you would get annoyed, frustrated, upset. But it doesn't end there. Usually what happens where the stress really comes into play is that you think the thoughts afterwards, you reflect on that situation, you say, how can I get angry at someone who has dementia? I must be really unfit for this. I must be a really bad caregiver. Even more than that, I'd be a bad person, like yelling at somebody with a cognitive illness. I must be crazy, unhinged. Like these are the things that I hear from folks. And obviously that would make you feel really guilty and shameful. And now this person is continuing to beat themselves up, continuing to create this narrative that they're a bad caregiver. And this cycle on the right side of the screen with the orange, that's really where the emotional stress lingers, and it can snowball from there. And that's where we see some of these higher levels and consequences of emotional stress when we get caught up in this spiral. Now, there's a buzzword that I think has been thrown around a lot lately of self-compassion. And so one way of thinking about self-compassion is in that second exercise I had you do, where you were talking to a friend versus talking to yourself. A self-compassionate response would be pretty similar. Unless you were yelling at a friend, I don't think anybody here would like yell at a friend seeking help. If you were, compassionate and empathetic to them, and then also being compassionate and empathetic to yourself, that's self-compassion. And this is a really important thing to kind of build along the journey, especially when that journey comes with really stressful situations sometimes. So again, this is a lot of people have been talking about self-compassion, particularly in the past like 5 years or so. Different people define it different ways. Some people really talk about mindfulness. I don't talk about mindfulness as much. So the way that I think about self-compassion is kind of these 3 domains. So the first is self-kindness, and this is just not being so hypercritical or judgmental of yourself. So in the grilled cheese incident, it got pretty judgmental pretty quick. Like, I'm a bad person. I'm a bad caregiver. The alternative, something that's more self-kind, is understanding your experience. Rather than rushing to these judgments and criticisms of yourself, thinking about, okay, I was pretty aggravated in that situation. I felt, like an attack. I wasn't acknowledged. Also, I have to stand up for grilled cheese because grilled cheeses are delicious, and this, I need to defend their honor. But understanding your own experience is a more self-kind approach than these judgments. The other component of self-compassion is recognizing that as humans, we all make mistakes. We all require help at times. We're all learning. Again, for over 4 decades, we've been studying the stress that caregivers feel. And that means that, the situation, the emotion that's coming up for you has probably been felt before. And people have, addressed that. So, there's a common element to humans, and it's imperfect. And, holding space for that and remembering that, this is, other people have been here before. All humans make mistakes, and luckily we have the capacity to learn from those mistakes. And the last component is stopping this negative emotion spiral. So for grilled cheese gate, it spiraled in the right-hand side. It didn't just stop at, oh, I lost my cool there. It, the guilt, the the shame kind of made the person stew on it, and they kept beating themselves up. So we want to really not get so hung up on those thoughts and emotions when they come up, and really try to disrupt that spiral, from now I'm judging myself and I'm, beating myself up days later after, the grilled cheese incident. So self-compassion is, again, very well studied. We have a measure, like we can measure it. People create interventions to increase the level of self-compassion that people have. And in research, caregivers who are more self-compassionate, so caregivers who in that response to another versus themselves, the ones who would have similar responses, not only have psychological and emotional health benefits, but they also feel more confident as a caregiver. They feel like they're in more control of the situation, and they have higher physical energy levels. So there's a lot of benefits to, some of these emotional health changes. And I don't love this analogy because I feel like it's a little played out with like the and when you're on a plane, they say to put on your mask before other people. And I do think it applies to this situation. To be your best self as a caregiver, you really do have to take care of yourself. When you're not, taking care of your emotional needs, when you're burnt out, you're really not going to be the best caregiver that you can be. And that's going to get in the way of also being able to savor some of those positive aspects of caregiving. So it is really important to take care of yourself in order to take care of other people. And it's hard. It's not that, I think people have heard this before, especially in the dementia space. People are always talking, oh, it's so stressful. Like you need to take care of yourself. I'm sure that everyone has heard this hundreds and hundreds of times, and it's easier said than done. So I want to talk about some of the things that get in the way of being self-compassionate. And we're going to go back to the first exercise we did today with the examples of caregivers. A lot of those attributes like selflessness, patience, compassion, when we think about them as we always have to act this way. We set unrealistic expectations for ourselves, and we set ourselves up to not meet those expectations. And then we beat ourselves up, and we're not very self-compassionate because we have unrealistic expectations. So the other thing, the reason why I have you think of your caregiving role model is what I hear a lot is my parent or grandparent, they took care of a spouse or a parent, and they were so devoted and so loving, and they were such a good caregiver. They never got angry. And I'm like, is it possible that your grandmother didn't want to tell her 10-year-old grandchild just how stressed she was, or air out like marital issues to her grandson? So I think that we sometimes get a skewed view of what a good caregiver looks like. And I also think like all of us, like in MADRC, like Alzheimer's Association, I think we are also a little bit to blame from this. Usually brochures, and our clinic is guilty of this as well. Brochures are smiling couples, it's a little bit more attractive, to have happy people on brochures, and that's not always the case. So again, when we are a little bit rigid of I have to be selfless all the time, then it leads to some less self-compassion. The other things that impact self-compassion are some personal beliefs. So perfectionism is a big one. Everything has to be perfect. I once had a patient who their mom was very orderly. And so she felt like if she didn't fold the blankets perfectly, that she was doing a disservice to her mom, and it like would snowball from there. Little bit, we can have a towel that's a little out of place. But having that perfectionism can sometimes be a barrier to self-compassion. Another one, very, very common, is I'm the only one who can provide care, or I'm the only one who can provide good care. And that might be true for some components of care. And it might not be. There are some tasks that maybe others or professionals can do better, like surgery. I hope nobody's doing surgery out there. Like that might be one to leave to professionals. But in general, especially when we're burnt out, we will tell ourselves this to kind of keep going, and it kind of doesn't allow ourselves to take a step back and get the care that we need. The other things, like depression, health issues, those get in the way as well. But I also want to highlight that caregiving is met with very strong emotions. So two of the strongest emotions out there are love and fear. Love and fear make us act in a very certain way, in a very intense way. And so those are very present during the caregiver journey. And when there's love and there's fear, everything feels bigger. So a lot of times things feel bigger because of those big emotions that come with caregiving. And honestly, it's a great thing. To be doing an act of love is beautiful. And it ratchets everything up a little bit emotionally. So just a couple tips for self-compassion. Really thinking about those thoughts. So again, going back to the grilled cheese incident, the incident happened, your response is your response. It's that thought afterwards. So some tips are, check in on yourself for self-kindness. Notice how you're talking to yourself. Is that how you would treat a friend? Knowing that you deserve the same respect that you show other people. Thinking beyond yourself. Other caregivers have felt this way. People are imperfect. We're always learning. Maybe I didn't respond the way that I wanted to in that situation. I understand why I responded that way. And next time I'll try better. Try to do a different thing. Simple as that. I think the biggest take home is we're not our own judge. So we're not making judgments about our character or if we're a good caregiver or not. Our role is more like a detective. So I think it's better to ask why than to have these like generalizations. So why did I act that way? Do I need a break? Do I need more help? Also, why am I being so critical of myself? Do I have unrealistic expectations? Being a detective, your own detective, can be very helpful in identifying some of these thoughts. And there's many research studies out there that address just this topic. So at MADRC, there's the social study, which talks about self-compassion. So it kind of elaborates on some of the things we talked about today. There's also mobile apps. So these types of skills for managing stress rather than hopping on Zoom, you can just open it on your phone. There are interventions in English and Spanish. Emotional stress and particularly in care partners is very much part of dementia care. And so there are, again, a lot of studies through MADRC that are targeting this topic because, again, it's very much part of the experience and the treatment of dementia. The best way to sign up for these studies is to join the registry here at MADRC. If you scan this code, it'll take you to a link to sign up if you haven't already. And that would probably be the best way to get enrolled in these studies. I will say that participating in research is a great way to get emotional support. Sometimes the wait list is shorter, and you a lot of times will get paid to participate. And again, we know what works. So these interventions work very well. We're really testing how to best deliver them. But a lot of these skills, again, over the years, we've really developed a lot of skills and we know work. And in addition to research, there's a lot of resources out there. So the MADRC has a really great website. They have a whole guide for caregivers, and they do talk about emotional stress. At Brigham, there's the Center for Brain and Mind Medicine. At MGH, we have the Dementia Care Collaborative. They provide education, training, counseling, so really helping you through certain stressors and support groups. And then in my center at MGH, we're starting a new caregiver clinic that really focuses on psychotherapy with psychologists. So when those emotional stressors get kind of big and start to impact your mental health, meeting with a trained psychologist for psychotherapy can be very helpful. And we're going to be accepting new patients soon. I'd love to be able to get the word out on that when we do launch through MADRC. But there are many resources out there for folks to manage their stress. And that is it from me, and I will stop sharing, and thank you so much for your attention.
Okay, thank you so very much, Dr. Plys, for sharing and affirming the importance of self-compassion. We each have our own story to tell, and as a research ambassador for MADRC, MADRC, I've been asked to take a few minutes and share my story of caregiving for my husband, who was diagnosed with Alzheimer's 8 years ago. I began by wondering how I could use this audience's precious few minutes to share what to me feels important and meaningful to caregivers across the spectrum, from those who choose to voluntarily take on this role because a loved one has been impacted by this tragic disease, as I did, to professional caregivers. My husband's words seemed to give me a starting point. He wrote, "Alzheimer's can be a lonely, frightening disease. It is quite scary to recognize that your mind is fading away, maybe in just little bits that only you recognize. In its early stages, it's not noticeable to many in the outside world. Many who don't really know what you are going through, that you who had once had a brilliant mind are now stumbling through the day." And I want to dedicate my story to all the caregivers in the audiences, to my friends and family members who are caregivers, and to the caregivers who have come before me, upon whose shoulders I stand. Caregivers from previous generations, many of them Dr. Plys talked about, who didn't know the support or caring I have received. And also to the Brigham and Women's team within the Center for Alzheimer's Research. They have been an unexpected gift, who open their arms to us and embolden us to continue to move forward with resilience, courage, love, and hope. My journey as a caregiver began when I retired as a full-time educator and was able to start spending time with my husband, who had also recently retired as an environmental attorney. I started seeing differences and changes. Forgetfulness became more pronounced. Thus began our yearly visits to the neurologist at Brigham and Women's in Boston. I was 63 and he was 68. Yet we were still able to fully maintain our lives moving forward. Then came the frightening day that changed the course of our lives. Sometimes change happens like this at an accelerated pace. Neil had had a successful career as an environmental attorney. He could create environmental maps needed for natural gas pipelines and power plants he and his colleagues built. Spatial relations, understanding directionality, and mapping was a gift. So I still remember with fear 8 years ago when we were walking in the Boston Public Gardens in downtown Boston, Massachusetts, and Neil couldn't remember how to get to Newbury Street. This is a main thoroughfare, a main street in downtown Boston that begins in the public gardens and was a short distance from where we were and where he had lived and worked when we first met. Soon after this memory loss episode, and after talking with our neurologist at Brigham and Women's and our friends, we galvanized our strengths, waded through the unknown, and volunteered for an Alzheimer's drug trial that was going into its third and final phase at the Center for Alzheimer's Research, CART, the EMBARK study. We embraced the opportunity to work side by side for the common good. Early on, my husband and many of our research ambassador dear friends, some of you I see in the group today, said, let's remember, if this does not cure me right now, it will help this disabling disease in the future. Throughout our careers, we had both developed respect for scientific data and research undertaken in the hands of smart and well-informed professionals who truly wanted to do good in the world. And we wanted to share that message with all of you. Neil had used research to help save the environment, and I had used it to make learning accessible for all children. Neil and I have always believed in science, the good it can do. We consider Boston one of the world centers for medical innovation, and Brigham and Women's a true community of excellence for research for Alzheimer's disease. This was important. We would have a team of doctors, nurses, and scientists watching over us with care, concern, and rules for patient safety and protection. We were welcomed in this community from the very beginning, and this was so important. The welcoming, the caring, every question Neil and I had was answered. In its early stages, and this was important, this was a new learning for us, in its early stages, Alzheimer's did not come with an immediate tragic ending to the lives we had known. We were very fortunate. We could still continue to move forward, and in a way, we still are. Once in the trial, as prepared and informed as we thought we were, we've thought about what helped us stay the course for 8 years and continue with Neil's monthly infusions and all the different tests and assessments that sometimes had us traveling to Brigham's several times a month over the past year. We didn't know if Neil was getting a placebo, if he'd get a side effect. He did. We were going on trust. And after all these years, Neil is considered as a responder to this drug. We have developed close relationships, very close relationships with those on this same journey, and have become volunteer research ambassadors, which is why I'm here today. The kindness we have encountered is beyond whatever we can give back. So I'll end by returning to the words of Dr. Plys. Alzheimer's and caregiving can be lonely and stressful for both patient and caregiver. However, you need not be alone. We are fortunate enough to live at a time where professionals such as Dr. Plys have focused their research time and expertise to think about us, to enable us to take care while caretaking, to learn how to have self-compassion and self-kindness. And yes, I have learned to hang up my superwoman cape. It's all true. It is essential, if at all possible, to keep closest to you what I was fortunate to be able to do. Keep loving, kind, helpful, and empathic people on your journey. people who can walk with you without passing judgment and without a critical eye when all you are trying to do is get through every day doing your best. Some days better than others. My caretaking has been sustained through the volunteer work, through support of loving friends and family, and by being able to maintain our life that we had before, the cognitive stimulation that comes from the volunteer work, our passions for art, music, dance, our love of yoga and Pilates, my work, an attempt to eat a Mediterranean diet, which we're getting better at, and taking part in the therapeutic groups with like-minded folks that Dr. Plys has talked about. Please, everyone, take good care of yourself, and may you go from strength to strength.